Hi guys, in today's video I'll be talking about low sperm count. When a couple is finding it difficult to have a child, who do we blame? We both know most of the blame goes to the wife. That's when you hear things like she has many sexual partners when she was in the university, she has done many abortions, she has been into plenty relationships. But most of the times the problem comes from the man. So let's see things for ourselves in this video. In this video, we'll be able to know what is low sperm count, what are sperm cells, causes of low sperm count, the treatments, and also the prevention. Let's get started. Low sperm cells, which is also known as oligospermia, means that the semen that is being released during copulation contain few sperm cells than normal. What are sperm cells? Sperm cells are the male reproductive cells that are produced in the testes. What are their main function? Their main function is to fertilize the egg, which is the female reproductive cells. They are to fuse with the egg and fertilize the egg. So in 1 milliliter of semen, we should have 15 million sperm cells or above. Anything below 15 million sperm cells per 1 milliliter of semen, it is called low sperm count. So moving on to what are the symptoms of low sperm count. I need you to know that most of the men having low sperm count, they don't have symptoms at all. They don't have. They only find out when they are finding it difficult to impregnate a lady. That's just the only way they can know that they have low sperm counts. But some still experiences all the symptoms I'm about to mention. Like the first symptoms, like I said, difficulty impregnating a lady. That's the first symptoms. Another symptoms is low sex drive. Like I said, some of them don't have any symptoms, so low sex drive, and then erectile dysfunction, like they might not get full erection, swelling in their penis, yes, pain or swelling in the testes, watery sperm. Sperm is supposed to be whitish and thick. It's not supposed to be watery. Do you get? So when a guy has low sperm count, they can experience watery sperm, but not all the time. So the common test that is used to diagnose that someone has low sperm count is called sperm analysis. That's just the common test. So in sperm analysis, they'll be able to see sperm count. Like I said, it should not be below 15 million. They will get the sperm count. They will also get sperm motility. Motility means the movement of sperm. Normally, the sperm should move progressively forward. You should move towards the egg, progressively towards the egg. There are different types of movements. There is progressively towards, there is progressive movements, and there is non-motile. Like the sperm is not moving at all. They will just be vibrating on one position. They'll be like this. You see them under the microscope, they'll be like this. Some are moving, but they are not progressive. They are moving. They can be moving backward. They can be moving side by side. They are not moving forward towards the egg. In this same sperm analysis, they will be able to see sperm volume, the volume, how many sperm is released during ejaculation. Some don't release enough sperm during ejaculation. Inside this sperm analysis again, they will be able to see the morphology of sperm, like what I showed you now. If any sperm is different from what I showed you, it's not going to fertilize the egg. If it has two heads, it will not fertilize the egg. If it has two tails, it will not fertilize the egg. If the tail are short, if the sperm itself is short, it will not fertilize the egg. So in this sperm analysis, they will also see sperm morphology, and also they will see the color. What's the normal color of sperm? Whitish, just whitish in color. They should not be yellow, they should not be black. In this sperm analysis also, they will also see they will look for white blood cells. If there are too many white blood cells, it gets that there's an infection somewhere. It's part of what they will see in sperm analysis. So moving on to causes of low sperm count. But before then, I realized that when I was talking about the test, I was saying sperm analysis, but it's not actually a wrong word, but I feel like the standard is semen analysis test. So moving on, the causes of low sperm count has been grouped into two, which is lifestyle causes and medical causes. For the lifestyle causes, they are smoking, taking of alcohol, poor hygiene, lack of exercise, and some other things. Now, for the medical causes, this is where my focus is. One of the medical causes is hormonal imbalance. For a male hormone, we have testosterone. The testosterone is responsible for the production of sperm. You know what that means? If testosterone is low, sperm production will be low. And then follicle stimulating hormone. Follicle stimulating hormone, what they do is that they stimulate the seminiferous tubule in the testes. You know, I said earlier that the sperm is produced in the testes. So they stimulate it, they say, hello, oh yeah, produce sperm. So if follicle stimulating hormone are low, the production of sperm will be low also. There are other hormones that are responsible, but these two that I've said are the major hormones. Another causes under medical causes is infection. There are some infections that can affect the production of sperm. STI too, sexually transmitted disease too, there are some sexually transmitted disease that can also affect the production of sperm. And then varicocele, I don't know if I'm pronouncing it well, but I'm going to write it up here. That's not the bone of contention now. Let me explain it. It means there are some veins in the testes that are swollen. There are swollen veins in the testes, and if they are, that means the sperm will not be produced well. Also, undescended testes. Let me explain that. Undescended testes means that, okay, let me explain this way. During the development of a baby, the testes were produced in the abdomen. So, before birth or shortly after birth, they hope to move to the scrotum. Why are they moving? They are moving because they need a cooler temperature, cooler than the body temperature, to produce sperm. So when they are inside the abdomen, they won't be able to get that temperature that they need to produce sperm. So they need to come outside. They need to come inside the scrotum before they will be able to produce sperm. But if something happens and then they didn't move from the abdomen to the outside, inside the scrotum where they are supposed to produce sperm, there will be low sperm count because they no move. In some cases, one will move, the other will stay. Or the two self can even stay in the abdomen instead of them to move outside. What are the prevention of low sperm count? What can you do that will prevent you from having low sperm count? Number one is, like I said earlier, the production of sperm has to do with a kind of temperature that is colder than the body. So you need to maintain that temperature. You need to be sure that down there is not too hot. You need to be sure that you do not wear tight boxers. For those of you guys that you wear boxers, you first of all wear pants. I don't know why. You will wear boxer. You will wear small shorts before you now wear your trouser. God, that's not good. Just wear something free, so that the body can maintain the temperature needed down there to produce sperm. That's just the only prevention. No, if you want to add exercise, eat foods, eat healthy, and then hygiene, most importantly. So how is low sperm count? How is it treated? It is treated based on the causes. Yes, the first thing you do, you find out why you are having low sperm count before you can know the type of treatment. For the treatment, you can regulate your hormone if the cause is hormonal imbalance. If the cause is infection, you can treat infection. If the cause is sexually transmitted disease, if it's the one you can treat it. And then, if it is swollen vein that you can remove through surgery, you can also do that. If it is undescended testes that I explained earlier, they can also use surgery. So I hope this video helped you. This will be all for today's video. Bye.